I'd like to call the Joint Internal Services and Health and Human Services Committees to order. The first item is Pledge of Allegiance. Please rise.
Flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. The next item is the adoption of the agenda. Any comments?
Mr. Chairman, with your approval, I would like to remove item 7D from the agenda, if we can get approval.
Support, Center.
Thank you. The electronics is on the fritz. Voice vote. All in favor, say aye.
Aye.
Opposed?
Nay.
Abstain? Thank you. Motion passes. Approval of minutes. We have two sets of minutes, one from Internal Services and Public Services from March 11th and another from Government Oversight and Human Services Committee on March 13th. Motion to approve.
So move.
Support, Center.
Thank you. Any comments on either minutes? Voice vote. All in favor, say aye.
Aye.
Opposed? Abstain? Thank you. Motion passes. Public participation. This is the first opportunity for public participation for those who wish to speak for a maximum of 3 minutes on any subject that is on today's agenda only. There will be a second opportunity for public participation on any subject later in the meeting. Any public wishing to participate? Third call, public wishing to participate. Thank you. We'll close public participation and move on to presentations. Full board approval requested at committee due to statutory deadline and a waiver by Finance Audit Budget Committee to bring it forward to us on the Macomb County Equalization Report.
Chair, I'll make a motion.
Thank you.
Support.
Thank you. Motion made by Zong and supported by Ha. Thank you. You're on.
Good afternoon, everybody. It's a pleasure to be here to present this report. It's I don't know, 50-some pages, including some of the statutory required reports that will require some signatures from a couple of you later on. But there's three primary pages of this report because it's just a lot of numbers, and it's a tabular required report that I have to do each year. So there's a lot of numbers and figures in there. But there's always 3 pages that I point out to you guys, and then I will entertain any questions about the remainder of the report. So it's my page 5, your page 27, I believe. It's the SCV and the taxable value line graph. And, you know, we, in the past couple of years, because the inflation rate multiplier has been so high, that SCV is really jumping, right? But you can see that the taxable value, while it is still jumping, it's held at that 5% increase. And, you know, the last year's overall CPI and inflation rate multiplier was at just under 8. And so, you know, we're still on the tail end of that. We might see a little bit more of that next year. I'm thinking in between 3 and 4 for next year. Right now, we're still at 5. And so we're maxing out on the taxable value side for our capped values. And so we're seeing some nice tax revenues because of that. But this graph is kind of nice because it gives an overall representation of where we were way back right before the crash, and how we have recovered from the crash in 2008. So I always like to point that one out to you. And then the next item or page that I like to point out, because this is always interesting too, is the average residential true cash value. And that's on page 44 of my report. I believe it's 66 in yours. The obvious one is going to be Grosse Pointe. We only have 45 properties in there, residential properties. And so that $800,000 average is not typical for Macomb County. It's because of that zip code. But what I do like to see is Washington, Macomb, and Bruce are really coming up with their residential values. Washington's at 417, Macomb is at 382, and Bruce is at 366. So we are definitely spreading in a northern direction on those.
I'm more interested in the shed.
And then the last page is the next page, page 45, 67 in your book. This is the ad valorem taxable value change. And if this was in front of the Finance Committee, my boss, Steve Smeagol, would be here, and we would be talking about the potential for tax revenues for the county. And he and I did some discussion after he saw the report. The taxable values are increasing by 8%. And what that means for us, unfortunately, this year, because of the 5% increase in taxable values and a 5.1 inflation multiplier that's used in the rollbacks, we do have a rollback this year. And so that rollback is tentatively 0.9924. And so what that means for us in our taxable value increases, we're not going to see a full 8% in tax revenues. It's going to be closer to 7.25. But still, 7.25 is not too bad. In the past years, I've always advised Steve 2% is a comfy place. 2%, 3%. To be in the 5, 6, and 7s is very unusual, and so that's where we are. And those are the high points of this tabular report. And I would welcome any questions that any of you might have.
Commissioner Hall.
Thank you, Chair. Thank you for that report. When does the rollback kick in?
So during the process, we will have summer levies and winter levies. For the next month or so, I will be calculating those rollbacks. And they're based on whatever the millage rate was last year for whatever authority, libraries, police and fire, cities, townships. I calculate all of those. There's approximately 75 of them, some special assessment districts. So then when they fill out their tax rate request form, which is due at the end of September, I then compile all those values and I bring that to you in the apportionment report. That's in October. So October is when I summarize exactly what happened, where we are. Here's what the values ended up being, what the millage rates ended up being, and a good guess at what our tax revenues might be. But that's October.
So when you say when they bring it to you, you're talking about the local municipalities?
Every taxing authority fills out a 4029 tax rate request form. And then I check it to make sure that it's correct, make sure that they've applied the correct rollback. Because the schools get a little inky. They've got several different types of millages, and depending on the type of value that was used in that millage, an enhancement millage for MISD has PILTs and, oh my gosh, and rent zones in the value. Those values are included in that millage reduction fraction calculation. But for the majority of them, those types of properties are not included because they make a payment in lieu of taxes. So they should not be in the calculation, but it is for enhancement, which is weird. And then you have the school district, homestead versus non-homestead. I have to take all of the homestead properties out of those calculations, so it only includes non. So it's a lot of different, you have to keep track of what properties belong in which millage rollback type, and then put it in that. That's why that apportionment report is such exciting read for you. But yeah, that's what I do for you.
Thank you. Thank you, Chair. Thank you.
Commissioner Zinner.
Thank you. Kristen, this 8% or 7.25% is, I think it's unsustainable for people to live with. I just don't see where people are going to be able to continue it. It's looking at every socioeconomic group. It's becoming a great labor, a great problem for our society. Possibly the money that was given out to people a couple of years ago did not help with that inflationary period. Do you see any way that the money is going to, that the percentages are going to drop? Do you see them dropping, and how fast, and How do you see that?
So everything, when we calculate our taxable values, our capped values, which then become taxable values when you do that, whichever is the lesser of the SEV or that capped value unless it transferred, it's based on the consumer price index, which is a value that is tracked for a 2-year period and determined by the federal government. So as long as we have high prices for gasoline, eggs, all of those things go into the calculation of that CPI. Like I said, last year, it was 7.9%. So last year, when I came before you guys here, we had a situation where we had the highest increase in our taxable value, the full 5% on the calculated values. And because when I calculate the millage rollback fractions, I had to use the 7.9 in the calculation, which resulted in 0 rollbacks. So we had the highest taxable values possible and the highest millage rates possible. That like very rarely, if ever, happens. Very rarely, if ever. We've never had it this high. So because we're on a 2-year trend, that 5% or that 7.9, because in reality it was like 8, 9 for a long time, but it only ended up in that 7.9 place because it was a 2-year thing, and the second half of that second year, as it started to come down, that was built into the calculation. That part is still in the calculation for this year, which is why it was reduced from 7.9 last year to 5.1 this year. I anticipate it to continue to come down a little bit. I don't think we're gonna see 1.5 like we did anytime soon, but I like 2, 3. That's like a real safe place. We don't create artificial bubbles. We have no supply right now. There's no inventory right now. So the houses are selling for a lot more than normally would be paid for that type of house. Nobody's selling. I know I'm not gonna sell, I've got 3.5% interest. I'm not selling my house, right? So all of those things, it's hard for me to predict. I have a feeling it's gonna come down. I don't know how significantly it's gonna come down, but it is trending down. I don't see 1.5 to 2% anytime soon.
Yeah, I wish you.
But less than 5 would be. I'm more comfortable with that. When we had the bubble burst in '08, it was the perfect storm of all different things happening all at one time, and none of us were really prepared for that, and it's taken us all the way till last year to get to the same taxable values that we were then.
Same thing.
Yeah. Oh,
Same
shoot,
thing.
is that
Thank
my
you.
phone? Okay.
Thank you, Chair.
Commissioner Sabatini.
Thank you, Chair. Hi, Kristen.
Hi.
So in regards to the differential, like in the increase in taxes that we're going to be receiving across the board, whether it's school districts, whether it's the county, whoever's that tax base is related to, specifically the county, what approximately is that increase in revenue that's going to be coming to the county?
So if Finance Director Smeagol was here, he would have that number right for
I thought you might have it.
You know what, I did. We calculated it, what day was it? It was some day last week, I think it was Wednesday. And I could get it and
I would
email
love
it
to know
to
that
you.
number,
Okay.
just in the sense of, and I'm sure Steve is thinking.
Oh, he's already working.
Oh, I
Yeah,
know.
it's already
I know.
going. Yeah.
I want to be a step ahead of what he wants to spend it on
Right?
because I have some ideas.
Uh-huh.
So if you could get us that number, that would be great.
Okay.
Thank
I'd be
you. Thank
happy
you,
to do
Chair.
that.
Do you have information about how many properties in the county are in default of their taxes?
I don't have that. Treasurer's office would maintain
Because
information.
all the counties that are in default would take the top off of that increase, would it not?
Probably. So here's what you always have to remember about my figures. My figures are as of the conclusion of March Board of Review. There is tax tribunal appeals that will begin now. There are state tax commission class changes, which would have effects on stuff. any of my predictions, my calculations are not based on that. Mine are all based on right now, today's figure, and then the state equalized value. So I have to go back to the days when I used to predict when I worked for Independence Township. That's why I like 3, 4, and 5. You know, those are much more comfortable figures than to plan on that full 7. You know, there are some changes happening. And then, of course, we have the other situation this year. In 2014, we passed the veterans exemption. In the past 10 years, we used to take those values off the roll. So it would be 0. Not this year. This year, they're in that figure. They're in these figures. So that 11.5% increase that's happening, some of it is from the veterans coming on the roll that have not been on the roll in the past year. And the way that the state has decided to do it is it's going to be a toggle in our program that signals to the treasurer's office program to not send them a bill. But I still have those numbers in my stuff. So they're not in the millage reduction fraction calculations. They're coming out of there, okay? But in the total increase amounts, they are there. And there's really no way for me to get them out of there because they're there. And unfortunately, a lot of the local units have decided to wait to enter those. So I can't even see them because they're waiting to roll their database until after this meeting. Then they're going to go in and enter them. So I don't even know I don't have any record of what they are in my database because that information wasn't in their database to come into mine. It's something that I could ask, you know, and that is a big, huge question across all the treasurer's offices throughout the state is what kind of an impact is this having? You know, there's a lot of us that wish this would have just become an income tax exemption and not, because they keep saying it's on the veteran, not on the property. It's not a property, but we're treating it like one. So, yeah. So unfortunately, I don't have those numbers.
Thank you. Seeing no other
Mr.
question.
Chairman,
Yes, sir.
what is the value of what is the industrial value of real estate in our county trending? Is it staying flat? Is it staying, is it diving? Is it going up?
Well, let's see. I have that in
I'm sure
here.
you do.
Yes. So that would be, you're talking real property, correct?
Yes.
It has it's a slight increase. Not a whole lot, from 2.9 to 3.2.
What's the 10-year trend? You got a 10-year trend? Is it 5 years? Did none of that, okay.
It's difficult because the personal property is exempt now, for the most part. There are still a handful of them out there that refuse to apply for the exemption. They just want to do it the old school. I mean, we can't make them file the paperwork to be exempt and pay a tax someplace else. So to me, that should be an incentive. You know, your property taxes are a little bit different now. Your personal property is not going to be an issue for you. You know, you're going to pay it a little bit
I'm just
differently.
trying to see if there's more investment based on the taxable values that are out there. I mean, Macomb County is a growing community, but are we really growing, you know, in all sectors?
Well, and, you know, with the marijuana situation with the grow facilities, those are starting to be tapped out and not performing as.
It's probably gonna burn itself out.
It's already in those stages. It's already in those stages. And so a lot of those buildings, they paid a lot of money for those buildings and the values became inflated because of that. But in the end, if you take all the expensive stuff out, that is an industrial building.
It is. All right. This is very much interesting information for us. We've heard it, we've seen it. Could you produce us a graph or something that we could post on our website to talk about the values in all by communities, you know, or a trend for the county that we could put out there so that the public can, I couldn't keep up, my computer wouldn't load enough to keep up with the graphs you pointed out earlier, but I think that'd be good for us to tell so we just let the public know, you know, what the values are across the county by community, and it'd be helpful for them. And
Do you want a separate one for each community?
well, it's gonna be difficult, maybe if you just put one for the county maybe, and then they got a link they could check out where your community is under there. Send us the information. We could have our marketing people do it, but
I'm glad you are
we're
very
just trying to-
confident in my skills.
I'm looking for something that we can get. What's that?
I'm glad you're very confident in my skills to produce that, but I know people, know people.
Well, I don't ask you to prove, just,
An
I need a chart
interactive
or
graph.
something that we can look at and say, guess what? Here's the values across the county, it's increased X%. And then just click on a link that we can go to and find, or give us the chart and we'll create the link for you. You don't have to create a link. We'll just give us the information they go into the chart so they can see their individual communities, just so we could push it out there a little bit.
Okay. I will get right on that
It's a
for you, sir.
goal without a detailed plan behind it, but we'll
Okay.
get there. Thank you. Thank you, Mr. Chairman.
Seeing no other speakers, please vote, voice vote. All in favor, say aye. Opposed? Abstain? Thank you. Motion passes.
Thank you.
We'll move on to item 7A, Budget Amendment for Information Technology, i3 ImageSoft Incorporated, Mentis aiSmartbench for referees of the court.
Chair, I'll make a motion to combine
$45,900.
A and B.
Support A and B.
Thank you. We have a motion and support for A and B. Commissioners Hall and Romano. Jaco?
Good afternoon, Commissioners. This is to purchase 5 more licenses for aiSmartbench. It is used by our judges on the bench. It allows case documents and notes to appear in aiSmartbench and for documents to be created and modified within this system and then sent to OnBase. It obviously helps them while on the bench. You know, other benefits is for them to manage their docket, the management of documents like motions and orders, and then quick searches for cases and access to. So it's just for the purchase of 5 licenses at a cost of $45,900.
Thank you. Commissioner Zinner?
Thank you, Chair. Jacob, what will those costs incur every year? Is there every year charge for updates and all that kind of stuff?
Yeah, there's a maintenance cost of $7,650 in the first year, and it goes up gradually. Year 3, it's $8,115 for those licenses.
Thank you, Jacob.
Are these new licenses going to be bundled into the other licenses for that maintenance
For
schedule?
that system, yes.
So it's going to be short for these and then they'll roll in with the others. Thank you.
Chair, can I ask another question?
Certainly.
Thank you. I'm sorry. So there will, and I don't know if you have this answer, Jaco, will there be a person there, someone with skills to do this kind of work, or this is just a faster way of getting it done in immediate time?
This is a faster way for the judges to be able to do the work from their bench. When they have access to OnBase, they don't have access to all these documents and the ability to make the changes to the documents while they're on the bench. So they can issue those orders, do it pretty quickly, and, it flows much better and quicker for. We implemented this a few years back for just a few judges, and they've been working with it and are now comfortable with it, and now they want to expand it to, other people in the circuit court.
Thank you. Thank you, Chair.
Thank you. Seeing no other speakers, please vote. All in favor, say aye.
Aye.
Opposed? Abstain? Motion passes. Thank you. We'll move on to item 7C, Agreement with Information Technology for Maintenance Agreements for the second quarter of 2024, Core Technology, Talent Lean, and Onyx Networking. I'd like a motion to move to full board.
So moved.
Support. Thank you. Commissioners Romano and Perna made the motion and supported to move this item to full board. Jaco?
Commissioners, this is just some of the maintenance items that we bring to you from time to time. The first one, core technology for lean law enforcement network information or information network. That is used by the sheriff's office to access, information about people that they stop and things like that. And then the second one is Virtru, which is email encryption, and we use that especially in the health department, where we work with HIPAA data and any other areas where we need encrypted email. Just want to mention that this cost will actually go away once the new Microsoft environments is implemented fully, because Microsoft has its own encryption built into the system. So we're gonna then stop paying the cost to, for this Virtru email encryption.
Thank you. Seeing no speakers, please vote. All in favor, say aye.
Aye.
Opposed? Abstain? Thank you, motion passes. And with that, we will move on to item 8, Health and Human Services Committee, and turn the gavel over to Chairman Placido.
Thank you, Commissioner Van Sickle. We'll move on to item 9, department recommendations, and we'll start with Mr. Cox, I believe is here. Budget amendment for Health and Human Services, Michigan State Housing Development Authority, MSHDA Emergency Solutions Grant in the amount of $356,731. Can I get a motion to move to full board?
Motion to move to full board. Support Zinner.
Motion by Perna, support by Zinner. Hi, how are you?
Good afternoon, Commissioners. How are you doing today?
Good.
It's beautiful out there, so hopefully we can get out soon and enjoy the weather.
I think we will.
Cloudy yesterday afternoon at this time.
Yeah, it's not cloudy
It
out
was a
there
little
now.
dark.
So,
I know the weather changes.
make sure that you wore your glasses for that solar eclipse too, Commissioners. So don't damage your eyesight. But too late now. So wait for
Yeah.
next one.
Thanks for the
20
advice.
I can't see very good now.
20 years. Good afternoon, Commissioners. I'm asking for you to approve a budget amendment for Health and Community Services to accept our MISTA, Michigan State Housing Development Authority Emergency Solutions Grant, or what we call ESG. This is directly to support shelter operations for homeless. Previously, McCrest stepped in temporarily. April Fiedler, the CEO over there, did a fantastic job in not only providing services for shelters, but also being the fiduciary for this grant. It has become really overwhelming for April, and she has asked others to step up, and Health and Community Services felt like we had to take that step and step up in this role. So we will serve as the fiduciary for the COC, the Continuum of Care, which is to support homeless shelter operations. It's ESM and ESF, so it's two separate funding sources. So if you see those two pots, they both support different types of shelter management, shelter functions, but it's both for the same operations of homeless shelter support. So my staff is able to handle this duties. We're not asking for additional staff within Health and Community Services. But we really felt strongly that in order for this important service to help support the providers, there's 6 providers for ESM, 7 for ESF, to help support those providers in processing payments and getting those payments out to those providers as quickly as possible so they can do the great work they do in the community to help support us. Be happy to answer any questions. Thank you.
Thank you. Commissioner Zinner.
Andrew, hi there. Are those Macomb County citizens? Do you know? Are there?
Correct. So these are, the allocation goes out to the shelter providers. So some of the shelter providers would be Comprehensive Youth Services, McCrest is one of those. Our own MCA is for Community Action. I said Salvation Army. Community Housing Network is another provider. And Perfecting Community Development Corp, or Perfecting CDC is another name that they come and go by. But these are Macomb County providers.
So the people who need help are those Macomb County citizens?
Correct.
Is that checked? Is that documented?
Is it checked? Yeah, so they have to submit reports, case files. MISTA also does, as a fiduciary, we would do case reviews. So we'd pull random files from each of these providers and make sure that they're providing appropriate care and support and documenting that, which include where's the individual from, residency from Macomb County. We don't look at every single file from these providers, it'd be too much, but we randomly sample and do that sample size, and so does MISTA as well.
I think you once told me it was at least 2 years. Is it longer or?
For the grant, it's 1 year.
No, for the checking of the documentation of the citizen.
We have to do reviews every single year. And with that is that, looking at that residency as well, when we do those reviews.
Thank you, Chair. Thank you.
Thanks, Commissioner.
All right, seeing no other speakers, can we please vote? All those in favor say aye. Aye. Any opposed? Any abstain? All right, motion passes. Moving on to item B, a budget amendment for Health United Way for Southeast Michigan, master grant agreement for the year 2024, advancing healthy babies, or healthy births, sorry, in the amount of $50,000. How are you? It's close enough.
It's close. Hey, you got it. We all know.
Oh, yeah, motion moves forward. Thank you. Motion by Zong, supported by Wallace.
Thank you, Commissioners. This is a request to approve the budget amendment to increase our health budget and specifically our infant mortality program and maternal child health program. This is a grant that was given to us by United Way to use specifically to address infant mortality rates. Infant mortality rates, especially in different pockets and populations, demographics, persons of color. The disparity is very clear in the data that persons of color are much more likely to unfortunately have a infant death in their family. So what we want to do with this money is host community expo events that educate individuals and families on infant safe sleeping techniques. So a lot of this grant is going for covering those expenses for those outreach events. Be happy to answer any questions. Thanks, Commissioner.
Thank you.
I have a
Commissioner
question,
Zinner?
but I'm not in the right area. Thank you, Chair. With these situations, I saw there's, I forgot the name of it now, help with feeding infants, something in relation to infant professionals helping with making sure infants are fed properly or something. Do the mothers get enough food? Do we know that the mothers are receiving, do they receive food during this time period? Do we know that the mothers have enough food, first of all?
Well, I hope so. I think that's always well, that's why we have the programs we do with our nurse family partnership outreach, our field nursing, but also more importantly, our WIC program, which is not specifically addressed in this grant. That's a little bit different. Okay. But that is nutrition. We have lactation consultants that help individuals with breastfeeding. Well, again, we advocate for breastfeeding, but it's not a forced thing. That individual has that right to make that decision. Right. They do get support for formula through the WIC program, so that's another great asset and a program that we are always very proud of at the health department is that WIC program that helps. That's all about nutrition and families and babies and keeping kids young, keeping them safe and healthy and thriving in our county.
Yeah, especially if the mother's trying to breastfeed, that she has adequate nutrition and.
Absolutely.
And I know some lactation professionals, if they haven't breastfed themselves, they don't necessarily know. I mean, they can read about it, but it's a little different.
Yeah,
I do appreciate any help that they're getting.
It can be very difficult. I don't have any experience myself, but my wife and my family, even we have 4 kids, and each one of them was slightly different, and she benefited very, very much from that assistance, that one-on-one lactation consultant, because it can be frustrating at times too, but it's very important that we give any kind of support we can to families and mothers.
Yes, thank you.
Thank you.
Andrew, and thank you, Chair.
Thank you. Commissioner Wallace.
Thank you, Chair. I think that this is a great program that you guys are doing and bringing to different communities and bringing awareness, which is key. So if we as commissioners wanted to help or get involved, would we be able to spread awareness?
Yeah, absolutely. I think anytime that we can work with you and do events, outreach, my same spiel, outreach in the community over and over again, but we want to back that up with actions too. So anytime we can help support events, that we're always looking for that partnership.
Okay, great. I will be reaching out to you.
Thanks, Commissioner.
Commissioner Brown.
Yeah, thank you. My questions followed along Commissioner Wallace's line. What communities are you targeting in the county? Because you have data that shows where there's issues. Where are those at?
Specifically for this commissioner?
Yeah,
or?
for this county, yeah.
Right, because depending on the topic, obviously those could change very much, but there are some certain trends. A lot of the communities in the southern end have high rates. Mount Clemens, we also want to target, but also New Haven. Sometimes people don't equate that, but there are pockets of New Haven that the poverty rates are very high compared to other jurisdictions as well. So it is not just one, the north or the south. There are pockets, I would say, all over the county that we are targeting and looking to get into.
And how will you identify the pipe? What are your ideas? Or if you have them, maybe you don't have them yet. How are you actually going to get the word to the population? Commissioners are great in the districts. They're happy to support an effort, and they probably could help you maybe identify some things. But how are you going to bring the people there? How can we help you?
Well, I think, how to get people out is giving them something that they need. How to get them out to those expos. I want to provide something that, perhaps they get supplies or safety kits, if it's safe sleep kits that we can give out, resources.
Is that in the budget?
Education.
Does
That
come out
is
of the
part
budget, or
of
is
this
that something
budget.
you've got in the house already?
We do have a budget for that, and we do some of that already. This is just
Yeah.
going to help, support that even more.
All right, thank you.
All right.
Thank you.
Thanks.
Thank you, Chair Brown. So you are going to be going out to different communities. Exactly how many of these are you going to do?
We're still planning that, so
Still
we'll have to see, how far the supplies go, and 50,000 is great, it only
Yeah.
goes so far though too, so we need to make sure that when we do events, we do them well, and they're well supported, so we're kind of in that planning process after we get this approved.
And then when you do move forward with the events, do you guys usually try to reach out to like the local different like churches and things like that, because they do have usually like such a high following of especially minorities in different communities?
Absolutely. We have partnerships, but I think it's never complete. We're always looking to do more.
Okay.
And work with churches. So if you know of churches or you hear that they'd be willing to work with us, absolutely, please connect me with them, because we love to work with them.
Perfect. All right. Commissioner Zong.
Thank you, Chair. Does this grant also cover a full-time position?
No,
There's
it'll
a personnel
offset some
line.
of personnel expenses of some of the nurses that are out at these events doing the education, but it's not enough to support a whole position.
Okay, so it's not, there's already a position in place that this grant will supplement
Correct,
some of their hours?
correct.
Okay, and are you guys working with like the hospitals, like Ascension, and clinics to do
Yeah,
outreach to?
Henry Ford, Ascension, McLaren, they all have community-based programs that we work very closely. So I have those conversations on a regular basis with our hospital partners to see, that we're not duplicating efforts. How can we work smarter and better together? What are the hospitals doing? What communities and programs are they reaching? And then also looking at what could we provide in terms of gaps, in the communities, or services or education that the hospitals can't provide that we could possibly provide. So it's a very good partnership that melds really well together with the private healthcare institutes.
Okay, and I know this is focusing on infant safety, sleeping, and lactation. Are these sort of like the two top issues that you're seeing in terms of disparities in communities of color, and why have you guys decided to focus on these two?
So this was a priority area that was identified in our community health needs assessment that collects data and looks at data and really gaps and really trends that are negatively in the county that we want to address. And that was one of the priorities is infant mortality rates. Again, when you look at infant mortality rates compared to persons of color, that it is a drastically difference. That rate is about 3% for white individuals in Macomb County, and it goes up to almost 10% for persons of color. That's far too much of a disparity there. So we have to do better with trying to give resources and education for those persons of color to families and reaching out to those communities. So we use data very much to drive this. This is a very specific grant that, is infant mortality based. That's really the focus of that grant. So our hands are tied with this grant, but there are other areas within our community health needs assessment that is online that you can view that looks at different other priority areas as well. Chronic diseases and such are definitely up there with trying to prevent obesity rates within youth is another topic, priority area too in that report that we identified.
All right, thank you. Thank you, Chair.
Thanks, Commissioner.
Commissioner Brown.
Do you have numbers? 10% is terribly high number in America. But what are the numbers? Do you have numbers of?
I do have those numbers, Commissioners. I don't want to say national or state average numbers.
From Macomb County, though, we've got it from Macomb, though, right?
Those are Macomb County numbers. I
Yes,
can tell you,
yeah.
unfortunately, it's not much better in the state or nationwide.
Thank you.
Seeing no other speakers.
Oh, one more thing, I forgot
Go
what I
on,
was
no,
gonna
right,
say.
Commissioner.
You're gonna produce literature that could be disseminated and put out? You don't have it yet, probably, or do you have?
We have
something?
some. We're going to look at specifically
Is there
if we
some of the
could.
commissioners interested in help promoting it?
Sure,
And
absolutely. We'll take
the
you up
best
on
way to
that.
do this, give them some information in a place where they, people would congregate that might need it.
Absolutely. And we'd be happy to share that with you.
Thank you.
Thank you, Chair. Seeing no other Commissioner Zenner.
Thank you. You're saying, I'll wait till he finishes.
I got it. Thank you.
Okay. You're saying this is from nutrition that they're tying, not lack of nutrition only?
No, I think there's a multi-factored reasons.
Multi-factored.
Not nutrition only.
Right.
That could be a part of it. It's a lot of different factors.
Okay.
Cohabitation is a big one.
Yes.
It's co-sleeping in the
Okay.
bed. Try to educate about, say, sleeping in cribs without putting like stuffed animals, blankets. That's another risk factor. So there's several risk factors for infant mortality. And some of it is also very much attributed to living situations of individuals and families as well.
Yes, yes. If you watch the news, the local news, I hate to say, you see situations, and it's certainly not pretty at all. I think things should be addressed. I hope they're addressed with these situations. That is absolutely horrendous, and thank you for telling us that statistic. Thank you, Chair.
You're welcome. Thank you. Seeing no other speakers, can we please vote?
Yes.
All in favor, say aye. Aye. All opposed? Motion passes. Thank you very much. And we're moving on to item C, a budget amendment for Office of Senior Services, Home Health Adult Day Services Respite Program in the amount of $15,480. And we have Sheila here. How are you today?
Good, how are you?
Refer to full
Hey.
board, Chair.
Thank you. Motion by Commissioner Haas, support by Commissioner Sabatini.
Oh, good.
He was too quiet for you to hear because he had his mic on, so, but I heard him. Hi, how are you?
Good, thank you. Good afternoon, Commissioners. What you have before you is a budget amendment to increase our adult day budget through an agreement with Ageways. The program, they will be providing $3,000 vouchers to seniors who meet the criteria for admission into our adult day program, which is dementia specific. It's targeted to individuals who have Medicaid only and are on the home help grant. So it's really geared towards lower income individuals who need adult day respite. They're living with caregivers, or the caregivers need respite for their loved ones. So it is for a year, and we're looking forward to expanding our services through the adult day program and really helping those individuals in the lower income range for services.
Thank you. Commissioner Brown.
How many individuals do you think you're going to be able to help with the grant?
Not as many as I'd like. It translates to about 22 days of respite care for those individuals.
How many individuals can you serve with that?
It depends on how many they refer to us. So it's really unpredictable at this point. Those referrals are going to come from AgeWays. So AgeWays is going to identify the individuals that qualify and then refer them over to us.
22 days out of a year.
22 days out of the year, yeah, is what it translates to.
How will the clients know about this? How will the person that are dealing with these issues?
AgeWays is going to contact them and look for them through, they'll have information from individuals that are in the home health grant and who also meet the criteria of having Medicaid, and then they're going to refer them directly to our adult day program.
Do they have to come in through that avenue, or is there another way a person could come into that program with?
Yeah, unfortunately not. Right now, the way it's set up is AgeWays is going to be the primary, they're going to review the admission and refer them over to us.
So if the public knows who the contact at AgeWays is, that's the way we wanted to let them know about it, right?
Yeah, they would go on the AgeWays.
Can you let me, and I'll share with my board, that contact so
Sure.
that they could,
Sure, absolutely.
make people aware of it somehow.
Yes, I will do that. It's a great program. There is a big gap in services, so they're really going to be, like I said, targeting or identifying lower income families that need that respite. Our private pay is between $16 to $16.50 an hour through our adult day program. So it's expensive to have that care.
Can a person match that to combine the money so that make it last longer, perhaps?
They could, yep, absolutely. Or extend it beyond the 22 days, yep.
Like everything else, we can't do it all, but we can do something for somebody, so
Yeah.
thank you.
Yeah,
Thank
it's a
you,
great-
Madam Chairwoman.
Great opportunity.
Thank you, Chair Brown. Commissioner Zinner?
Yeah, the chair asked my question, thank you.
Oh, Commissioner Van Sickle?
Thank you. Do we vet and ensure the people we put in people's homes, the workers we put in people's homes?
We do, AgeWays does, but this is on site. So this is at our Goldenberry facility. So the individuals are on site for the respite.
Where is that, at Verculen?
Yep,
Okay.
right next to my office.
Thank you, Chair.
Thank you, Commissioner. Seeing no other speakers, can we please vote? All in favor say aye. Aye. Any opposed? Any abstain? Motion passes. Thank you very much.
Thank you very much.
And now we'll move on to item number 10, public participation. And I see no one here, so I'll close that. And we'll move on to commissioner comments. Seeing no commissioners, can I get a motion to adjourn?
Motion to adjourn.
Support.
Go ahead, sorry.
We're adjourned.
Lost out.
Let's stay till tomorrow.
Even quicker.
We voted?
All right. I want to let you know that we're working with IT to put out a bid for the new system, so
Oh,
we had a meeting last week on that, and it's progressing, so we're also talking to Oakland County about going and joining on the bid. They have the same system, and they've had some issues too, so they're considering going on a joint bid with us. Maybe we get some benefit of scale. I also reached out to NACO, and they're providing us some information on terms of other major counties that use similar systems like this, and which one of the ones that gave back was this system that we got.
Sure.
I go, well, not so much, but anyway, but they're helpful too, so we're reaching out, so, thank you.
thank you, Chair. So we have motion by Commissioner Romano and support by Wallace. All those in favor?
Aye.
And I don't think anyone's opposed. Motion passes. Let's